our first question comes in the form of an observation of a comment.
Ooh.
So this listener saw a comment that they can't stop thinking about. If hepatitis B is spread through sexual contact or shared needles, why are we giving the vaccine to babies at birth?
Great question. Okay. It is true that hepatitis B, a virus that causes cirrhosis of the liver and liver cancer, can be spread through sexual contact and shared needles, but that's because it's spread through bodily fluids, including blood. So that's not the only way that it is spread. And it's extremely contagious. It's about 50 to 100 times more contagious than HIV, and it can be spread through casual contact with very small amounts of blood, like the amount that would be on a shared toothbrush or washcloth or razor. And most people don't even know that they have Hep B until years later when it begins to cause liver damage. 2.4 million people in the US are estimated to have it. 90% of kids who are infected with Hep B within the first year of their life become chronic carriers. So the reason that we vaccinate at birth is twofold. First, vaccines given within 24 hours of delivery reduce the risk of Hep B being passed from an infected mother to child by 75%. And this can be very important for people who don't have consistent access to care, who maybe didn't get adequate prenatal care, or who might be lost to follow-up after delivery. Like we just talked about in this episode, how congenital syphilis is on the rise, likely due to a lack of prenatal care. So someone having Hep B and not knowing it and not getting vaccinated for it, not out of the realm of possibilities. The other reason it's recommended after birth is to give the infant some level of protection from infection within the first 10 weeks of life before their regular vaccine appointments. Like I said, Hep B is very contagious and a lot of people don't know that they have it. So it gives you coverage within the first 2 months and can also be a benefit for people who might have a hard time making follow-up pediatric appointments because at least then they've got some level of coverage, particularly, everyone wants to see the new baby. If you have a family member or friend who doesn't know that they're infected, you just don't want to risk passing that on to the kid.